Staying healthy, staying sexy, staying young is what living life is all about. And if you have doctors that have proven treatments that keep people young and healthy so they don't get sick, you want people to know about these treatments and that they exist.
Have you ever wanted to know all about mitochondria but have been afraid to ask? Have you ever wondered why your gut is a jungle sometimes or feels like a jungle? Well, today you're going to learn more from Dr. Catherine Clinton, a naturopath from Eugene, Oregon. But first, this podcast is brought to you by Gainswave. Gainswave is a treatment done at your doctor's office to optimize erection quality without the needs of Viagra, Cialis. It's non-surgical, there's no needles, and it has an amazing success rate. To find a Gainswave provider, go to gainswave.com. That's GAINSWAVE.com. And today we have Dr. Caroline Clinton from Eugene, Oregon. Welcome to the show.
Thank you so much, Dr. Catherine Clinton. And I am so excited to be here with you to talk all about health hacks.
Tell me about mitochondrial. Like, what is mitochondria?
Okay, so we're getting into one of my favorite subjects. And there's so much new research coming out about the mitochondria. So remember that our mitochondria are the powerhouses of our cells. So each cell has hundreds to thousands of little mitochondria in the cell, and they are completing the Krebs cycle and making ATP. And ATP is kind of our energy currency in the body. You know, we make about our body weight in ATP every single day. Those mitochondria are so busy and so active, constantly churning over new energy. And that's where we get our energy from. And there's some really amazing research out there that shows that the voltage of the mitochondria, when you have a dip in energy production, then you get chronic disease. And it's been associated with almost every chronic disease that we're seeing out there today: obesity, cancer, your autoimmune conditions, as well as mood and behavior, depression and anxiety, developmental stuff, ADD. I mean, the list goes on and on. They really are foundational for our health across the board.
Now, you were diagnosed with an autoimmune disease, correct?
That's right. When I was in medical school, I got a whole bunch of diagnoses. I got a diagnosis of ulcerative colitis, which is an inflammatory bowel disease. I was diagnosed with Lyme disease. I had all kinds of GI infections and parasites and heavy metal toxicities and all kinds of stuff. So it was a road to get back to health. But you know, in the last, that was, 10, 15 years ago. And I wish I had known a little bit more about the research that's come out since then about mitochondrial health, because it plays such a foundational piece. And we see, I'm a naturopathic physician. So in clinic, we see the power of treating mitochondria, and it's really interesting to see the new research really validating some of the things we've been doing for centuries, because they have such an impact on mitochondrial health. And so that's who I work with today. I work with people with autoimmune conditions, especially GI conditions, gut health, and with a special focus on pediatrics, because whenever we're looking at something like that, once you get diagnosed with an autoimmune condition or a chronic disease, that's been going on for years and years and years. Usually...
Let me ask you just real quick though, mitochondria, like if I take care of my mitochondria, is that the treatment for all these diseases and chronic illnesses, or?
It's going to play a part in all of them, absolutely. So a way to think of it is that mitochondria is really a foundational piece of health. And then, of course, all of us have some kind of weak link, right? Mine was the GI tract. Some people have a neurological weak link. Wherever your symptoms kind of express themselves, we can think of that as a weak link. And so we'd want to individualize treatment, of course, to whatever the person is presenting with. For myself, it was GI stuff. So making sure that you're having a foundational base in mitochondrial health, making sure that you're paying attention to that, addressing that, along with any individual symptoms or, your individual picture, that's going to go a long way to getting the balance back in health. Absolutely.
So would you notice like issues with GI? Is there a test to see what condition our mitochondria are in?
Absolutely. There's a great organic acid test where you can test metabolites in the urine and kind of see how the mitochondria are functioning in that way. And that's a really great test. And I do that with folks, and I do that with patients, and I also really rely on their symptom picture, because they should be feeling more energy. They should be feeling better once you start addressing mitochondrial health across the board, whatever the condition, the illness might be.
So when you talk about like an autoimmune disorder, like when we talk about autoimmune, we're talking about our immune system being weakened through damage. Like explain that to me real quick.
Absolutely. So our autoimmune conditions, we're seeing, the diagnosis across the board is if you have autoantigens, so little complexes in your body that actually attack some part of the body. For me, it was the colon. Some people, it's the myocytes, and you get a lot of muscle symptoms. Autoimmune conditions kind of go across the whole range of our physiology, right? There's GI autoimmune conditions, there's neurological ones, there's ones that deal with the muscles. They go kind of span the system. So what you're looking at is a really hyperreactive physiology. So our immune system, basically, we've got our Th1 that fights infections and cancer. We have our Th2 arm of the immune system, which is dealing with parasites and allergies. And then we have the Th17, which kind of plays into the other two, and that's the one we see in autoimmune conditions. And then the Treg cells that kind of put the damper on all of those. So what you see is a really hyperreactive, usually Th1 and Th17, where the symptoms come out as damage to the body from antigens that are attacking the body. And what we see with autoimmune conditions, it sounds like, my body's attacking itself. And, it's this really kind of scary context that it's put out. But really what it is your body's responding to a trigger. And once you can lessen or remove that trigger, the autoimmune reactions lessen or go away. And I've seen that so many times with my patients and with myself. And the triggers for autoimmune conditions can be as long as the lists of autoimmune conditions themselves, right? It can be poor gut health. It can be too much stress. It can be stuff in your environment, toxins, poor food, not enough exercise and movement, not enough time outside in nature, dysfunctional circadian rhythms. All of these things can contribute to an environment where your body creates these autoantigens and they attack a part of your body. And that's what we're seeing with autoimmune conditions.
So healthy living, sleeping well, reducing stress, eating right, helps keep our mitochondria in top condition, and that will help us stay energetic and will fight off any chronic illness.
It's absolutely a critical piece to maintaining health. Absolutely. And the more research that comes out about the mitochondria, there's supplements you can do and therapies you can do. But the really exciting piece about the mitochondria is living in the world the way we are supposed to, the way we evolved to, is really one of the best mitochondrial health hacks out there.
But that's easy when you're in Eugene, Oregon. But when you're in Miami, Florida, in like the city. Or somebody's listening to this there in New York, how do they do that?
Well, I was the same way. That was my first question when I heard about this. And there's a lot of surprising research out there. Concrete. So when we talk about, first, let's talk about why we want to live in the world the way we evolved to help fire those mitochondria. So what am I talking about? I'm talking about coming in contact with the sun and coming in contact with the electromagnetic frequency of the earth. And what that's doing is it's structuring the water outside of our mitochondria so that they can produce more energy, just simply put. And I'll just say that again. Getting in the sunlight and getting in contact with the Earth's natural energy frequencies helps structure our water outside of our mitochondria so that they can produce more energy. And if we're talking about someone in downtown Manhattan, they can go outside, especially in the morning hours before 10. Getting that sunlight in the eyes helps trigger our melanospin and our melatonin, and that has a huge piece in mitochondrial health. You can do that on the sidewalk. And speaking of sidewalks, concrete actually does transmit that electromagnetic frequency that structures the water and helps our mitochondria produce energy. And you can get that from the concrete. So going out on the sidewalk on a sunny day in the middle of Manhattan, while there are more benefits if you're in the middle of the forest, you will absolutely be able to reap the benefits of sunlight and grounding and helping structure that energy production in the mitochondria, even if you're in the concrete jungle.
So you feel that right away. Like if I'm having a stressful day, my energy level's low, when I go for a walk and I feel a little bit more energetic, is that because the sunlight and the energy force is bringing our mitochondria back?
Absolutely, absolutely. It's structuring that water pattern so that the electrons can flow freely and abundantly and create more of that ATP. You know, it's the same thing that we're seeing with saunas and infrared saunas, some of the red light therapies that are so popular nowadays. And why are they so popular? Why are they making us feel so good? Why is the research showing such good results? And it's because of this exact thing that I'm talking about. The light, the infrared light is helping to structure that water outside the mitochondria, which increases our production of energy across the board.
So when you see, like you mentioned, like red light, I've seen red light laser or red light therapy for regrowing hair, for the face. What else is it doing? Does it increase blood flow? Does it?
It does, and it depends. There's different kinds of categories. The near infrared versus far infrared, they're doing different things as far as how much they penetrate the skin. But what they are all doing is they are all boosting our mitochondrial function and production of ATP, our energy, as well as boosting the numbers of mitochondria in the cell. So my head has a hard time wrapping itself around the kind of size requirements of this. We're talking about a microscopic scale cell filled with thousands of mitochondria, but we want to pack it as much as we can filled with mitochondria. So that's what the red light is doing. It's helping us increase production of energy through the mitochondria, as well as making more mitochondria in the cell, which of course is going to create more energy production as well.
So let's get back to gut health, though, because like gut health, you can't just put red light over your gut, or I guess you can, but how do you treat gut health? Eating better, obviously.
Yes. Well, when someone comes in with some gut health issues, first we have to kind of do a little detective work and see why it is that they're having these issues. And it can run the gamut. People can have food allergies, food sensitivities. leaky gut or intestinal permeability can be caused by so many things. We think about diet first and foremost, which is absolutely true. Processed foods, additives, the emulsifiers, all of those things can cause leaky gut and cause damage to the gut lining and the enterocytes, the cells that line the gut. But it really goes beyond that. Lack of exercise also can damage the gut. So a sedentary lifestyle can also cause intestinal permeability. Some of the most amazing research out there that I think is so cool how it ties it all together is stress and trauma can cause intestinal permeability or leaky gut. So you've got so many different factors. You've got your food and your diet. You've got your stress and trauma levels. You've got movement. You've got sleep. Sleep is another one, coming back to that circadian rhythm. That's another one that causes just frank leaky gut. So when we're looking at gut health, first we have to kind of remove the problem. Maybe someone's eating food allergens and they didn't know about it. Maybe someone's exposed to a moldy environment or regular toxins that they need to detox from or avoid. And adding things back in, like healthy sleep, healthy movement. And when we're talking about diet, one of the things I really like to hit on with people is our resistant starches.
What's a resistant starch? What does that mean?
So our resistant starch is in foods and it doesn't break down. So it enters into the colon and it's fermented by our gut microbiome. So all those little bacteria that live in the colon, actually throughout the GI tract, but especially in the colon, they ferment that resistant starch into short chain fatty acids that help feed the gut enterocytes and help really solidify those tight junctions so that leaky gut doesn't happen or intestinal permeability doesn't happen. So making sure that your diet is packed with resistant starches is a great first step to feeding those enterocytes, feeding the gut bugs, getting those short chain fatty acids on board. And foods that are high in resistant starches, fennel, asparagus, all your onion family, your onions, your garlics, your leeks, they're really high in resistant starches, and the benefits of that can be seen with gut health, the tight junctions, like I mentioned. The enterocytes in the gut are held together by tight junctions. They look on a microscope, they look like a zipper. So when everything's nice and healthy, they're a nice tight zipper. And then when there's any kind of irritation, like we're talking about from processed food or stress or sedentary life, it looks on a microscope like the zipper's being pulled apart. There's teeny little slits where microscopic pieces of our food can get into the bloodstream of the body and kind of increase inflammation and deal with that whole immune system we talked about and kind of skew us to a more inflammatory state, which is not what we want.
So when you talk about the gut too, like we hear a lot about probiotics these days. Mm-hmm. How does that help with our gut health and our mitochondrial health?
Absolutely. Well, so the gut really is an ecosystem, is a good way to look at it, right? It's got, just like your forest, it's got trees and shrubs and bushes and mushrooms, mycelium, moss, all of these different species working together. And probiotics are important because, we are experiencing a mass extinction in the Western gut that we've never seen before. And so that's kind of what some of the microbiome sequencing research is about. And so getting that, getting down to the microbiome and feeding the microbiome and how that interacts with your health is going to be so foundational. And like I said, it's just going, the connections go everywhere. That resistant starch that we were just talking about, the ecosystem of the gut. Let's take it back to the forest. So if we remove the mushrooms from a forest, the health of the forest is going to decline. If we give that species of mushroom back, it's going to have the species that it needs to flourish, but probiotics aren't a magic bullet. You have to tend to the whole forest. So if we put, like I said in this forest analogy, if we put probiotics or mushrooms back into the forest, we'll see an elevation of health in that ecosystem of the forest. Just like if we replace a missing strain of probiotic or bacteria with a supplement, we'll see an increase in health. But if we don't tend to the whole ecosystem, it'll just be a fleeting increase in health.
I love the jungle metaphor. Sometimes my gut feels like a jungle and sometimes it feels better, but like I've heard that antibiotics is what's causing this extinction. And it's not just the antibiotics we take from getting sick and doctor giving you antibiotics, but the antibiotics that we're getting through other animals, through chicken, through beef.
Absolutely. Absolutely. Antibiotics is a huge source of extinction for our gut microbiome. And it is the top pharmaceutical prescription right now in the US. So it's no wonder that we see that. But like you said, our food supply is chock full of antibiotics as well. And then you look at our food supply being chock full of preservatives and emulsifiers and additives, which also derange the gut microbiome. And what's hard about the antibiotic piece is that it's at least a year for those bacteria to come back on board. And we've even seen research that shows it's kind of like a valley with a ball. The ball can kind of go back and forth between the hills, but if the ball gets kicked over into the next valley, it's hard to get it back. And that's what they're showing with the gut microbiome, is that around antibiotics can sometimes derange the gut microbiome for life. So we absolutely are doing a doozy on our Western guts with the amount of antibiotics we take and the amount of antibiotics that are in our food supply. And if we're talking about needing a year of antibiotic-free life to get that gut microbiome back on, we're starting to see how hard it is.
Well, it sounds like you're going up against Big Pharma, and it's going to be a hell of a fight. They have all the weapons at their disposal. But
Absolutely.
how are you working with people? Is it one patient at a time? I know you have a book coming out, but how do people learn more about this and how to address their own issues?
Absolutely. Well, that's one of the things that I've been really concentrating on in the last few years. We can only do so much one-on-one help with people, that I've really tried to boost my social media presence. And that's what I do, is I just dump content out every day, every week, so that we can kind of shift the picture and start shifting that balance of health back. Because you're right. The pharmaceutical, Big Pharma is a huge player, and the narrative that we've been living is also a huge player. Antibiotics aren't horrible. They're life-saving. They can be miraculous when we need them. We just need everyone to get on board about when we need them. Everybody, and then that's really my passion, is getting the information out there so that we can talk with our doctors about it, be able to have an educated conversation with your doctor about, okay, how does this look, this antibiotic script? And I've got a lot of content about that as well on social media, because it's important that we're talking with each other, that we're talking with our friends, our families, other providers, and with our own doctors as well. That's how this change is going to happen.
That's really, I learned a lot. I want to thank you for your time. It's fascinating. How would somebody find out more? How can they visit you?
Well, they can find me at wellfuture.com/blog, and that's where I do a lot of my blogging. And finding me on Instagram and Facebook is probably the best way to get my up-to-date content, because I'm doing Instagram lives, and I'm putting out content, like I said, daily, weekly, just trying to, beat the drum. Our modern life has kind of steadily marched us away from the things we need to be healthy. So I'm out there with my drum set trying to march us back.
Out there in Eugene, Oregon, in the healthy sunlight and the earth. Enjoy. Thank you so much, Dr. Clinton. I really appreciate it.
Well, thank you so much for having me. It's just an absolute pleasure, and I can't wait to speak with you again.
You too. Take care.
Take care. Thank you.